Today we're going to demonstrate the BioDerm Sciences Wound Management System. It consists of 4 products: a solution, a dressing with reservoir, a cleanser, and a cream. The dressing is applied in the operating room over the incision. Center it over your incision or wound and gently adhere it onto the patient. Go with the patient's body folds. You do not want to pull this dressing tight. It will shear the tissues of the skin. The second layer to come off is the layer that has the blueprint peel on it. Gently hold this down and you press this onto the patient's skin. You instill 5 cc's of solution into the smaller dressing. I have 5 cc's in the syringe. I'm going to use a butterfly, but you can also use a needle. You want to go in bevel up and go in laterally. Remember, this has 2 layers in this dressing so that you won't stick the patient. You gently insert this in and you can see the fluid fill in the dressing. I'm going to give it a few minutes to absorb before I take it out. The zinc iron solution decreases inflammation, which will decrease pain and edema and decrease scarring. We will take out the needle. There may be a little bit of fluid, and if there is, just take a gauze and pat it gently. We need to cover that injection site to maintain our antimicrobial activity so that we don't have any microbes or contaminants going into our dressing. The dressing provides a barrier from microbes and contaminants. It can stay on for 4 days, which is going to decrease your staff time and your cost of your dressing. To remove the dressing, you can start at a corner, and usually it lifts easily up. I'm going to hold the transparent dressing steady to give the wound support and not cause any trauma when I remove the dressing. You can see that I'm pulling laterally, parallel to the skin, so that it releases the adhesive and doesn't cause any trauma to the patient. The pad is moist, so when that comes off, it will not adhere to the wound. Because it's moist, there's no crusting and no scabbing. If it's a slight open wound, I can take the solution and cleanse the incision and the peri-wound. And this is something that's so simple that I could teach this to a caregiver and it could be applied at home. The zinc iron solution inside the cream decreases pain and it's soothing. It also is acidic, so it has antimicrobial activity. You just squirt a little bit onto a gauze pad and onto a gloved finger, and then you rub it into the wound or into the incision. This is going to increase the elasticity of your scar to prevent contractures. The zinc iron solution will decrease inflammation, which is going to decrease scarring. It will decrease hypertrophic scars, and it will decrease keloids. We do this twice a day for about 30 days, and then the scar tissue will be strong enough and it will fade into the skin. In closing, the BioDerm Sciences Wound Management System can be used together or individually. The system offers both positive clinical results and economic benefits. The clinical results are the system aids in closure time, reduces scarring, and reduces the risk of infection. The economic benefits are reduced staff time in caring for the wound and shortened length of hospital stay.